Hi, I'm Lee Miller, physical therapist.
And I'm Matt Emery, physical therapist. So Lee, what are we talking about today?
Well, I thought we would talk about what everyone's talking about, and that's the COVID-19 pandemic. We, as outpatient physical therapists, have a role in helping to manage some of the side effects of the pandemic. Since the COVID-19 pandemic hit, we have seen an alarming number of cases of acute neck pain.
Well, why do you think that is?
Well, when talking to patients, I find that when working at home, they're working in awkward postures. They're working in bed, they're working on the floor, they're working on the sofa or recliner, and that's putting a strain on their neck.
Yeah, exactly. I'm glad you brought that up. I've noticed this too. And look, I get it. I understand why people are doing this. Who doesn't want to work in their bed, work on their couch? It's comfortable at the time, but the thing is, it's setting people up for bad posture. That's why we're seeing things like increased forward head. We're seeing some rounded shoulders.
Wait, what do you mean by forward head?
Well, forward head is sort of when the head is forward in front of the thorax, okay? As well as rounded shoulders, which are when we're having the shoulders sort of curve in like this.
Right.
And that positioning is putting a lot of strain on the bones and muscles of the neck,
Okay.
which in turn pinches on the nerves of the neck.
Right.
So when those nerves get pinched, that's when we see this wide array of symptoms. So you and I are seeing everything from headaches to nausea to tingling and pain down the arms. We're seeing jaw pain or TMJ pain. We're just seeing a lot of different things, and it's gotten to the point where it's really an epidemic of its own. And you and I around the office have been calling it COVID neck.
Yeah, so I would guess that people that have pre-existing conditions like arthritis in the neck or disc problems in the neck, that's making that problem just that much worse. And where they may have been managing okay when they were sitting at a proper desk, now in all these positions, it's making these symptoms come alive.
Right. And the good news is that we know is that a lot of this stuff is manageable, it's treatable. And you and I wanted to make this video so that we could give people at home some ideas for things that they could do to change their office setup, and maybe some exercises that they could do to improve their posture and improve the way that they're working every day.
Okay, so how about if we get started?
Let's do it. All right, so the next thing we're going to talk about is your at-home office setup with a desktop. So I want to start with the chair here. Now, we want to let you guys know that you really don't need to go out and spend thousands of dollars on a nice office chair. These ones that most of us have at home will do just fine, and there's some adjustments that you can make on your own to make it better suited for at-home office work. So the first thing I want to talk about is ample lumbar support. And when I'm talking about lumbar support, I mean support of that natural curve of your lower back. Now, a lot of these chairs don't have enough lumbar support. Now, rather than, like I said, going out and getting another chair, you can go and get a lumbar roll. You can get this on Amazon, Walmart. A lot of places have them, and they're fairly inexpensive. And you're going to put the roll low enough on the chair where your low back will be supported. That natural curve will be supported. And the reason supporting that curve is so important is because the entire spine is connected. So when your low back is in proper alignment, that's going to put your mid back in proper alignment, and that will in turn put your neck in proper alignment. And that's what we're really talking about, the strain in the bad positioning of the neck. So we have to start with the low back and sort of work our way up. Now I want to talk about the adjustments of the chair here. Now, a lot of these chairs, the whole chair can sort of tip back like this, or just the back can tip back. And what we're seeing is people are spending hours a day sort of in this tip back position. And you can see here, I'm having to flex forward at the neck, and my low back is not being supported at all. So for that reason, we recommend having your office chair in a full upright position so that the low back can be supported and you can be sitting up nice and tall. Now you'll notice the armrests here, that's what I'm going to talk about next. So we recommend having armrests that are low enough where your arms can be supported, but your shoulders can be relaxed. Now you'll see if these armrests are raised way up here, my shoulders start to hike up, and that's really pinching on the muscles, the nerves, and messing up the alignment of the neck. That's why they need to be low enough where your elbows can be at 90 degrees, your arms will be supported so that they can just float over the keys. Now I want to talk about the chair height next. So we recommend that you sit with your knees at 90 degrees, your hips at 90 degrees, with your feet firmly supported on the floor. Now you can see here my feet are touching the floor, but they're not firmly touching. So that tells me this chair is a little too high. So if we drop this a little bit, now I'm in that position we're talking about. So my feet are flat on the floor, my knees are at 90, my hips are at 90. So the next thing I want to talk about is the keyboard. Now we're finding a lot of you guys are working at desks that are much too high. And similarly to the high armrests, when the keyboard is too high, it's causing our head to come forward, our shoulders to hike up. And when you're working for hours a day in this position, it's really going to put a lot of strain on your shoulders, your neck, and it's causing a lot of these symptoms we're seeing. So to combat that, we're recommending a few options. A lot of the desks that are coming out now have these roll-out keyboards. And why these roll-out keyboards are nice is it allows you to have your elbows in that 90-degree position, have your arms relaxed, and it lets your hands just float over the keys. Now, if you're not able to get a roll-out keyboard tray like this, we recommend having a desk either low enough where, again, you can be in that position, or if you're working at something like your kitchen table, something you can do is raise the chair up where you're in that position. But now going back to what we were talking about earlier, we still need the hips, or the knees and the hips, to be in proper alignment. So what you can do is take some books, support your feet, and then you're in that more natural position. All right, so the last point I want to hit on is the monitor here. Now ideally, you have a monitor that can adjust up or down. If you don't, you can make these adjustments with stacking some books to make it higher, or take something away to make it lower. But what we're recommending is that the monitor is right at eye level, because if the monitor is too high, we're seeing people sort of tip back to look up, and you can see this extension position at my neck is putting a lot of stress, a lot of strain on the neck. But just as much, when the monitor is too low, we're seeing people sort of look down, and this flex position at the neck, again, is putting strain on those muscles, those joints, those nerves. All of that for hours a day is really gonna cause these symptoms that we're seeing. So we recommend monitor at eye level. And the last thing that's gonna go along with that is your eyewear. Now we're seeing people wear reading glasses when they're completing their work computer activities. And when you're wearing reading glasses, we're seeing people lean forward with their head forward, shoulders rounded. And again, when you're sitting like this hours a day, more strain on the neck, more strain on the shoulders. So we recommend not using reading glasses. And if you're gonna have to use these transitional lenses that a lot of us have, we wanna make sure, again, that the lens is in a position where the focal point that you're reading on your monitor is right at eye level. So if the focal point is too low, we're seeing people have to tip back like this. Again, that's gonna put stress and strain on the neck. And equally, if it's too high, we're having people lean forward. So we wanna make sure that your vision with your eyewear is keeping everything right in line so that we can get a nice, tall, upright position of the neck and shoulders.
Well, Matt, that was a great discussion about how to set up your home station using a desktop. But I have a laptop, like a lot of people these days, and so we need to make some accommodations to get in the right position. I'm gonna come over this way, and let's see what we can do, how we can make this different. So, the issue with the laptop, of course, is that the monitor is attached to the keyboard, so you really need a distance of about 12 to 14 inches between the monitor and the keyboard in order to get proper alignment. So very simply, let me get this lumbar roll in the right place, right above my hips. And I'm going to take a couple of these old anatomy books and place them where I need them. So now that monitor is at a good position for me. My progressive lenses have that in focus at the right space. I've got my keyboard at the right height so that my hands can float over the keyboard. My forearms are comfortably resting on the hip length armrest, and the mouse is here. Now, you can use a regular mouse, wired mouse, and mouse and keyboard if you have enough ports on your laptop. but you can also get a pair of wireless mouse and keyboard for about $35 to $50, and that will suit you just fine. And that's that simple.
All right, so we've already talked about ergonomics. We talked about, proper desk position, proper chair height, all that stuff. I thought we could talk about maybe some exercises that we could show people at home that they can do on their own.
Great, I'll be your patient.
Okay, sounds good. So the first one we'll do is some chin tucks. So, give them a nice side view here. And what you're gonna do is think about moving your head backwards and tucking your chin, okay? Now when you do this, and what you wanna do is make sure that you're not, it's not this motion,
Okay.
it's not this, the entire head is moving back, and you'll feel like you're making that double chin.
Kind of like your head sitting on a shelf and you're just pushing it back.
Exactly, yep,
Okay.
that's a good way to
That
think
works,
about it.
yeah.
Okay? So the next one is we can have you face this way.
Do I hold that for a period of time? What do I do?
Yeah, we recommend you hold that for anywhere between 7 to 10 seconds,
Okay.
and that's really kind of the required amount of time to get those muscles that we're trying to target.
Okay. We're releasing these muscles here that get tight from sitting all day, and we're strengthening the muscles in the back at the same time.
Right.
Perfect.
Exactly.
Okay. What else?
So we're just going to try to get the neck moving a little bit more.
Okay.
So let's have you face forward here.
All right.
Okay. And you're just going to move your head in different positions. So
Okay.
first, we're going to do some side bending.
Okay.
So you'll let your ear drop to this shoulder.
Oh, I feel that right over here.
Yep, that's what we would expect.
Okay.
And you'll come back, and then you'll let it drop to this shoulder.
Okay. So I feel like a tendency to pull up my shoulder on that
Right.
side.
You got to make sure that you're keeping these shoulders
Okay.
down, nice and relaxed, nice
Okay.
and loose, but keeping them down.
Got it.
All right. So we'll show that one more time. Down, keeping the opposite shoulder relaxed, and then same thing here. Okay. And for that one, we recommend doing that 15, 10 times, somewhere in there.
Okay.
You can hold it for a second.
Okay.
And so we'll also do some rotations.
Okay.
So you're going to turn.
Okay. My shoulder wants to come with me.
Again, yep. So we're going to keep those shoulders nice and relaxed.
Okay.
And come forward, and then we'll go to the left. And again, keeping that shoulder relaxed. We want the movement here to be from the head and the neck.
Okay.
All right.
Okay. I feel that all over here.
Good.
That's good.
Yep. So this is
All right.
again kind of like the last one. We're stretching and we're also activating some muscles.
Okay.
So it's working sort of on two things.
And what about shoulders? Do anything with those?
Yeah, I'm glad you brought that up. So the scapula or the shoulder blades play a big role in our neck positioning and our posture, and so that's something we really want to target. So
all right.
some exercises for that are really trying to squeeze these muscles right here in between your shoulder blades.
Okay.
And you'll sort of
I
feel
feel
the
that.
front of your chest.
I actually
Open
feel
up.
that right along my collarbones, really stretching me out.
Right, good.
Okay.
And the key for that is we want to make sure that you're not hiking your shoulders.
Right.
So sometimes when people are doing this, they'll have the tendency to go like
Yes.
that. And we really want to
Okay.
avoid that because that's one of the positions, if you remember from earlier, we're trying to avoid.
Right. So
we-
shoulders back, down and back.
Yep, down and back.
Okay.
Exactly.
All right.
And then the last one, sort of just building on that, is a shoulder roll.
Right.
Okay, so especially at this part of the movement.
Right.
Right. You're
Mainly
really
backward and down.
backward and down. Yep.
Okay. Okay.
So
Right.
if we're taking
So you're just kind of a relaxed, kind of not over stressing, not pushing to the end of the range, just
Right.
kind of nice, smooth motion.
right.
I think it feels a little bit better if I just let my arms hang down by my side
Yep.
rather than, yeah, that
Yep.
feels better. Okay.
All
I
right.
hope you have found this information to be helpful. And I hope that you begin to make these changes in your daily life and at your work at home.
And you guys can find more information about this on our website, about other things with COVID neck and some common conditions that go along with it. And our website's right here at the bottom of the screen. And we just want to thank everyone for watching. And until next time, be well and keep moving.